Hi, Stephanie. Welcome to the ProTax Community Partner Showcase. I know that you're a very busy clinician, so I really appreciate you taking the time to share some of your experiences and perspective with us. Um, so maybe you can start telling us a little bit about, your role and your work. I know you're an internal medicine specialist working in a community hospital in the northwest area of Toronto. Can you tell us more about where you work and how things has been?
Sure. So thanks for having me. So, like you said, I'm an internal medicine specialist. I work in a community hospital in Toronto. So my practice is based solely in a hospital. Typically, in a pre-pandemic time, I look after patients who are admitted to hospital with, pneumonia, um, diabetes, etc., infections. But during the entire pandemic, our hospital being in Toronto and being in an area with a high prevalence of COVID, we have looked after a large percentage of COVID patients requiring hospitalization during this whole year.
Hmm. I read your article recently in Globe and Mail, and you described your workplace as like one of the ground zeros of the pandemic, right? So can you tell us more how busy or intense those the ground zero experience been like?
Yeah. When we first heard about COVID last year, I think all my colleagues and I felt that this was never going to happen to us. This is a downtown academic sort of disease. Um, I think the first case was in Sunnybrook, and we thought that all the cases would be in similar types of hospitals. But quickly we found that, I mean, during wave one, the large majority of patients were coming from nursing home long term care, and our area services many long term cares, rehabs, and complex continuing care centers. And there were huge outbreaks there, and so not only our hospital had to go in to help with the infection control and controlling the outbreaks in the nursing homes, but we had a large influx of nursing home patients as well that came into the hospital. Unfortunately, many of those, by nature of the fact that they were elderly, they didn't survive. Um, it seemed that every day we were getting 10, 20 patients, not only just in the intensive care unit, but also where I work, which is on the ward. Um, it was very surreal, to be honest. They either got better or the majority of them, fortunately, didn't. And there was a large sense amongst the doctors, but also the nurses and the allied team, that there was a lot of helplessness in the situation, just because no matter what you did, there wasn't very much that you could do. And a lot of them, unfortunately, passed away. So that was wave one. There was thankfully a reprieve in the summer, and we were all hopeful that this was going to end. But unfortunately, we're all in the midst of wave two right now. And definitely our patient population has changed, thankfully, because of the infection control, the hospital helping out with that in the long-term care settings. That has improved. But by and large, we have seen a large influx of community patients from the community. So young people, frontline people who are coming in from with COVID, um, not any fault of their own. They typically, our patients are, like I said, frontline. They work in factories. They drive Ubers. They're personal support workers that work in the long term care, nurses. Yeah, and that's also very challenging in a different way, just because these people could be you. They could be your family, and they most of them are healthy, and many of them get very sick. And thankfully, with the advances in COVID research and the therapies that we have, the outcomes are a bit better. Um, so there is some hope in that, but it's still very difficult when you're admitting entire families with COVID, and then some of them don't do well.
Mm-hmm. And I think as you mentioned, and also in your article, a lot of the people are younger now and are frontline workers, right? And do you see the other social factors playing a role in terms of how different populations are affected throughout the pandemic and
Yeah,
how it evolves?
definitely, 100%. By and large, the majority of patients in the second wave are from racialized communities. They're from low socioeconomic populations, just by nature of where the hospital is situated. Um, we see that. Many of them live in multi-generational homes. So we see children who work on the front line. They live with their parents and grandparents, and some of them, the entire family gets sick. And thankfully, because the younger patients are young, they have that in their to their advantage. So they're okay and they get well. But parents, grandparents, some of them don't survive despite all our efforts. A lot of them, like I said, work in factories that may or may not be considered essential. So they don't have a choice. Like they have to go to work. There's no paid sick leave right now, so they have to go, often sick. And this is the consequences that we see, is that they come in and they're admitted.
Mm-hmm. So you've been working at it for like a whole year now, right?
Mm-hmm.
Like all of us being impacted by the pandemic for a whole year. So um, as a health service provider, how have you been impacted, by the experiences?
It's hard. It's challenging. I mean, I was talking to some of my fellow internists at the hospital, and it seems almost like Groundhog Day. Every single day, you go in, you wear the same scrubs, you look after your patients, you come home, and you do the same thing. Some patients get better, some don't, and I think it's like a defense mechanism almost, where you try not to think too much about their individual stories, just because it can be very, very overwhelming. Um, but inevitably, it does catch up to you. Um, you know, having so many sick people, feeling helpless, having so many people die unnecessarily. I think these are all preventable deaths. It takes a toll on your psyche, not just among the doctors, but also the nurses who I've spoken to, the allied, some of the, even the porters. They've talked to me about their experiences and the article, and they're thankful that we're talking about this, at least now, just because I think a lot of these issues have been swept under the rug for a variety of reasons. Um, so it's hard. It's
Mm-hmm.
been a long, long year.
Mm-hmm. So have the hospital system or the healthcare system put in any measures to support, the services providers within the sector? Are there any like ways that, they recognize and support the difficulty of and the challenges of your work?
Yeah, I mean, in the first wave, definitely, I think there was a sense of, in the hospital and in the community, there was a sense of like, we're all in this together. Let's go and clap for all the healthcare workers at 7, with the pots and pans. There were like donations from restaurants and companies or whatnot. So that was nice. I think it's worn on so long. I think everyone is fatigued from it. So I understand why the enthusiasm isn't so much there anymore. I mean, from the hospital, and they do recognize people's good work. I think there are services in the hospital for counseling if you need, and therapy. So that's nice. Um, yeah, I mean, I don't know who takes advantage of those things. I haven't personally. I find that it's more therapeutic to discuss with colleagues who are in it with you. It's just I don't know. It's sort of a team building exercise
Mm-hmm.
in this very, very strange year.
Yeah, so I think the access to these support, I guess, speaks to the other points you brought up, is about like the inequities in the system.
Mm-hmm.
Is it really, do people really have the means and access to utilize some of these supports if people doesn't have paid sick leaves, or,
Exactly.
or don't have the support to travel to where they can get vaccines and other things, right?
Yeah.
Um, and then the other point you brought up earlier was you see a lot of these deaths and infections as preventable.
Mm-hmm.
What do you mean by that?
I read an article in the Globe and Mail recently, about the sunk fallacy, where you continue to do the same thing and hope for a different outcome. And it seems that we have been continually doing the same thing and hoping for a different outcome, but inevitably the outcome is exactly the same. So we know what works. We know that people need PPE. We know that people shouldn't go to work sick. They shouldn't have to make that choice. We know that lockdowns work. We know that ventilation, those things are very important. Like small school sizes, all these things work, and it's not because of science from Ontario necessarily, but even if we look to our neighbors in, for example, I have friends in Australia, and they're completely different right now. They're completely open, and their death rates are so much lower than ours. So I find it very frustrating because we can look to our other neighbors in different countries that have shown different techniques and ways to prevent deaths and the pandemic from going on this long. And it's very frustrating to me personally for myself, to have to be in this for a year, but also most especially for the patients who don't have the choice of, should I go to work where I may get COVID, or should I not get paid today and not have food? And I think that's so frustrating, so wrong, and it makes me so angry. And that's why I think it's entirely preventable, just because we know what works and we're not doing it.
So that has to do more with access and whether people actually have some of those options to protect themselves, right? And whether the system allows and support those options and access. Yeah. So as we are now in the second and third wave, I don't even know how we should call it now. What you started to talk about some of the strategies that we know that was actually helpful, right? But what do you see are some of the emerging challenges that we still need to be cognizant of or mindful of as we move towards like vaccines and other phases of the pandemic?
I think we're in a very strange position right now, just because the cases are dropping. And because it's been so long in the pandemic, everyone is tired. So everyone wants to be out of this pandemic. Like I want to be out of this pandemic. I don't want this to continue anymore. I would like to see my friends and my family who I haven't seen in like months. But that being said, I think we have to be careful of complacency because of these VOCs, like the new variants of concern, which we've seen the examples in England, in other European countries, where there was complacency and the cases shot up and the mortality shot up again, and we're sort of back to square one with hospitals being overwhelmed and surgeries being postponed, care being postponed, everything being postponed. And so we're stuck in this limbo. So I think that's a challenge right now. I think the vaccine rollout is also a challenge because it seems that, again, it disadvantages a lot of people. I think that the rollout will be primarily online. And I know that either one, my patients in my community specifically, they either don't have access to internet, they're elderly, they don't know how to use the internet, or three, they don't speak English, and so they don't know how to access those sites. Like even in my hospital is very, very digitalized, and a lot of the, for example, if they have to pick things off the menu or know how to press certain buttons so that the nurses come or whatnot, or even talk to their families on their screens. But that is very challenging for the majority of my patients. It's challenging even for me, where I'm young, I speak English, I know how to use the internet. So I see that as a huge barrier to a large part of the community of my patients. Just it doesn't seem tailored to them, which again, the entire pandemic is sort of the theme of the entire pandemic.
Yeah, so I think if we go into the vaccine, there's probably like another whole long session that we can talk about those issues. But I was just starting to also beginning to connect with my elderly patients, to talk about the vaccine rolled out. And I think even as a community health service provider, I find it really hard to navigate all the different regions, and how the different units are rolling out their plan and accessing it online, as you said. So, and a lot of my Chinese Canadian or Asian Canadian patients who doesn't speak English as the first language also find it hard to, they have to depend on another level of support to get access, right? But people also have a lot of concerns and questions about vaccines, whether, because we're starting with the oldest population, and they're not from nursing home and long-term care now, right? So, people would have a lot of fear and questions about, whether they're going to get side effects, whether, the medication they're taking is going to affect them and all that stuff, and whether like support is available after the vaccine. So have all of those been part of the conversation as far as you're aware of?
I don't know, to be honest, from the hospital. And I mean, we have been administering, we were one of the sites that got vaccine very early on, I think because of our location and the number of cases that we had there. I think they did pretty well with nursing home patients, like you said. I think among support workers, there, like anecdotally, even in my own hospital, there was hesitancy, not among the physicians, but among like nurses and allied about receiving the vaccine. And I know there were educational outreach attempts with these people, but I wonder whether or not, I've been doing reading about it, whether or not it's like a culturally specific issue, whether, in the past they've had experimentation on persons of color, for example, and so there's hesitancy towards that. So I don't know if that was addressed specifically, but there were educational attempts to sort of reassure people about the side effects or the efficacy, et cetera, of vaccines. I don't know how that's going to translate into the community though, because again, like the community residents are very different even from nurses and personal support workers, et cetera. So that I think that definitely will be a challenge.
Yeah, because I was reading an article, I think in the Star a couple of days ago about, even amongst the nurses and the personal support workers, there was hesitation about getting the vaccines, right? So I think that as we rolled out more in the community, clearer information and broader approach to having culturally sensitive and language accessible information is quite critical, right?
Definitely.
Yeah. But do you really see that? Do you see a lot of hope from the vaccine rolled out? Do you see our lives getting back to pre-pandemic any moment soon?
Unfortunately, I don't think it's anytime soon. I think there is hope because of the vaccinations and the fact that we are getting more. You know, lately we have been seeing far fewer patients from long-term care, which is very, very reassuring. Because by and large they have been vaccinated, and that was a large population, especially in wave one, that got sick. That being said, we still continue to see, community patients who are elderly or frontline workers. And so I think that, especially with the variants of concern, I think that this pandemic is still going to go on for a while, and we need to be, we can't be complacent. So I think I have hope that hopefully sometime this year that, we can have some sort of normalcy back. But I think that it's unfortunately going to be at least a few more months before we see that.
Yeah, well, I guess at least we can look for the light at the end of the tunnel. But as we move toward that direction, what would be your suggestion that we can, help and contribute to the pandemic recovery or, support system as an individual and as like part of a community?
I think that the pandemic has really unveiled a lot of issues that were always there, but they have really resurfaced during this entire year. So things like race and racism and gender issues, and also poverty, and those factors. I think that in a strangely positive way, people are now more aware. I think they're more aware of like the need for paid sick leave, or the need for childcare, and the need for safer long-term care homes, or the need for safer schools and smaller class sizes. Um, and even in the race issues, it's unveiled, being Chinese, it's unveiled significant racism against East Asians, for example, lately. So it's good that we're talking about these things, and I think that bringing awareness helps in our society, just because I think that the first step to solving anything or having solutions is to make the issues known amongst the broader community. So I think that's good, and I hope that having these conversations will lead to people wanting to educate themselves better and wanting to be advocates and speaking out for others, especially if they are from a privileged part of society. That's my hope.
Yeah, so thank you so much, Stephanie, for spending your time and sharing your experiences with us. I think, having allies and community partners such as you really give us hope that, we are still in this together, and we hope to, be able to overcome this someday soon. So thank you very much again, and we look forward to working with you more.
Thanks for having me.